For millions of Americans, especially those approaching 65, Medicare is a lifeline to reliable health insurance coverage. But navigating how Medicare works can be a challenge for anyone wondering how to keep their golden years burning bright.
Medicare is very complicated, and for that reason, people often have questions and they need to know resources they can turn to make sure we're all on the same page. Medicare has 4 parts. There's Medicare Part A, which is the hospital insurance, Medicare Part B, which is medical insurance, Part C, which is called Medicare Advantage, and Part D is Medicare prescription drug coverage.
As someone who helps people navigate Medicare, Kris has found that many have misconceptions about the program itself.
One of the first misconceptions that they have is that they have to wait until they are eligible for full Social Security benefits to start Medicare. Medicare still can begin at age 65. For people who are drawing their benefits early as age 62, they need to remember that they're not going to have Medicare till 65, and they need to plan for their health insurance coverage in that gap period between 62 and 65. Actually, there are a couple of groups of people who can delay enrollment. One of those groups are individuals who are actively employed or their spouse is actively employed and they have health insurance through that active employment. In that situation, you can wait to sign up for Medicare Part B, which is the medical insurance, until you retire, and there will not be a penalty for delaying enrollment. Now, once you retire or are not actively employed, you do need to get signed up or you'll have a penalty. Another group that might want to consider delaying enrollment in Medicare, and in particular Medicare Part A, are people who have health savings accounts. Health savings accounts are a type of health coverage that employers offer where there are 2 pieces. There's a major medical health plan with a high deductible, and then there's what's called a health savings account that the employer and the employee can contribute to. With a health savings account, enrolling in Medicare can cause problems. And so people who have that option would not want to enroll in Medicare Part A or B because it would cause them problems. If you have retiree insurance from your employer, you cannot delay enrollment in Medicare. You will have a penalty if you delay enrollment and aren't actively employed. Retiree insurance and COBRA are not considered to be insurance from active employment, and so delaying going into Medicare Part B could result in a penalty. The same is true with marketplace plans. Delaying enrollment when you're Medicare eligible could result in a penalty, and the reason for that is that retiree health insurance pays after Medicare. So you need to have Medicare Part A and B for the retiree plan to then pick up what Medicare doesn't pay for. Some people believe that if you have Part C, which is called Medicare Advantage, that you don't have Medicare or that you're losing Medicare, and that's not true. Medicare Advantage is just a different way to get your Medicare benefits. Whether you decide to use Original Medicare or Medicare Advantage depends on your situation, and it would be good to sit down with somebody who's very knowledgeable about Medicare to go over those before you make a decision which way to go. Another thing that people think is that they have to sign up for Medicare Part D, which is the prescription drug coverage, when they become Medicare eligible. You don't have to, but you will have a penalty potentially later if you decide you want to sign up for Part D at a later time. There is one exception to that. If you have what's called creditable coverage, which means you have drug coverage that's as good as or better than Medicare's coverage, then you do not have to sign up for Part D. Some examples of that are the VA drug coverage, TRICARE for life drug coverage, the federal employee health benefit plans, and many employer retiree plans have creditable drug coverage. You don't have to sign up for Part D if you have one of those available to you. Also, people need to know that the Part D plans change annually, And so people can't be complacent. They can't sign up for a Part D plan and think that they're going to keep it for the rest of their life. Every year they need to do a review, and the time period for that is during the fall open enrollment period, which is October 15th through December 7th.
Medicare may be complicated, but resources like the Senior Health Insurance Program are readily available.
There is a network of organizations called the SHIIPs nationally. Here in Iowa, people can get help by calling our toll-free number, 1-800-351-4664, or by going online to www.therightcalliowa.gov. All of SHIIP's services are free, confidential, and objective.
Find out more by visiting wi65.org or follow us on Facebook and Twitter.